Everybody, or good day, depending on when you're listening to this. We're going to go ahead and go through the 2015 employee benefit programs for MedSource travelers. The MedSource Travelers Company has utilized Hylant as their benefits partner, and what that will do for you is give you another set of resources to reach out to if you have questions or concerns about your employee benefit program. So some of the highlights that we're going to be going through is we're going to be going through the medical, which is a new program with Blue Cross Blue Shield of Florida, also known as Florida Blue, and the new programs offered through Guardian Life for dental, vision, and disability and life. So presentations should take approximately 25 minutes, and once we go through that, you'll have contact information available to you if you'd like to reach out for questions. The purpose of this presentation is for recording, so if you're listening to this off business hours and try to reach out to us, email might be best, and or leaving a message on the voicemail will get your response. Okay, so a little bit about Hylant. Hylant is a family-owned company out of Toledo, Ohio. We've been around for about 85 years. The team that you work with through MedSource is out of Orlando, Florida. So we're very familiar with the Florida market as well as markets around the country. Joe Mowry, that's myself, along with Kate Hall, are your direct contacts. And of course, you can reach out to Hylant if you have any claims assistance questions where you get a bill and you don't understand why you have to pay what's listed there, enrollment questions, and questions about the benefits. So how does a benefit pay if you go to the doctor, or how does it pay for a prescription? We are here to help you make sure you understand the benefits and get the most out of your coverage. So a few words about healthcare reform overview. Healthcare reform is in effect. What that means is that the marketplace is up and running for those folks that would like to go shop for coverage there. Healthcare.gov is the website to do that. Keep in mind the open enrollment on healthcare.gov runs November through February. I believe February 15th this year. So it's not always open for everybody unless you have a qualifying event where you lose coverage. Those are an example of the reasons why you go to healthcare.gov outside of open enrollment. The individual mandate is in effect, and what that means is that all those in the household and listed on the tax return will need to have health insurance. The program we have put together for MedSource travelers is better than what we see on the exchange. But I think that, of course, depends on what you and your situation is. One of the questions we get is, how can we cover our dependents? And one of the things that we have seen the marketplace good for is to put maybe your children on their plan by themselves or a spouse, because that coverage might be a little less costly than the group coverage through MedSource travelers. So we're going to start with medical. The new plans with Florida Blue Cross are all PPO plans. With a low-cost, mid-cost HSA, and then 2 PPOs. So a little bit about the program that we've put together. MedSource Travelers is committed to providing the best coverage for their employees. We think we've got a good set of affordable options here for you. Really cool thing is that we're going to be using Benefits Connect to go through the open enrollment, which means you go to the website, click the link, just put in your ID and password. Your ID and password start out as kind of generic, and we'll talk about that later. And then you can go through, check yes or no for everything, and get enrolled. The plans on the Blue Cross side are all PPO plans. They work in all states that have a Blue Cross presence, which is just about everybody. Your plan elections will remain until the open enrollment next year in March. If you're hearing or viewing this recording outside of open enrollment, then know that if you waive now, then the next time we'll ask you is when we go through open enrollment. All employees must go through the online system and enroll or waive coverage as long as you're full-time and eligible. This is a requirement of ACA so that the government, when we report to the government whether or not you've been offered coverage, we can do that accurately. So we're going to start with the low-cost plan, the 5302. This presentation is via PowerPoint. You will receive a benefit guide from the office that has a similar type format, but definitely goes into better detail. And if there's something that we don't cover, please ask for the plan documents like the benefit summary and summary of benefits coverage, the SBC. and that will give you additional details. So we're going to touch upon some of the highlights of each plan and make sure to hit some of the points that we think are relevant. Again, reach out if you have additional questions. So on the 5302, there are co-pays to see the doctor of $30 and $55 for a regular family doctor or specialist. Preventative care services are covered in full, which means that there is no charge for your annual well-woman exam, your annual physical, immunizations for children. The list of preventative care services is about 63 services with specific timelines. So if you do have extra checkups necessary for your conditions, maybe you have an extra cardiologist visit every year because of heart problems that run in your family, those are not considered preventative. Those are diagnostic, and the copay will be assessed. Urgent care is at a $60 copay. Emergency room, you get to the first 2 visits at a $300 copay. Any visits after that will incur the deductible and then co-insurance after that. So the deductible on this plan is $5,000. After that, you pay 30%, the insurance carrier pays 70%. And then once you reach $6,350 in global out-of-pocket cost, meaning everything totaled up, prescriptions, copays, deductibles, then you're done. The insurance carrier pays for everything. So if you called me with, hey, I'm going to have surgery, what's my out-of-pocket going to be? I'm probably going to tell you $6,350. We talked about the no-charge preventative care. Lab services are at Quest. So if you're currently on the United Healthcare program or if you've been on a different program, make sure your doctor's office knows that they should send your lab request to Quest. You get 6 office visits, urgent cares or convenient care centers combined per person. And then after that, they are subject to the deductible and co-insurance. We talked about the emergency room visits. And then prescription drugs in this plan, generic is covered, brand is not covered. So make sure you know that. Some folks have to take brand names for their condition. In that case, you would be paying out of pocket for the prescription that you're getting. So the next plan is the HSA plan. HSA plans are plans that have certain features. The government allows you to set up a bank account and put money away tax-free. The plan 5192.93 from Blue Cross is a PPO, as we talked about before. Preventative care is no charge, so you're going to get your physicals and your annual well-woman exam, those things at no charge. You can set up an HSA account at your bank. We do not give any additional banking information because people are all over the country. It wouldn't make sense to. So if your bank offers HSAs, ask them and then advise MedSource if you're going to put money away in an HSA. So the features of the HSA are pretty clear. Large deductible of $2,500 individual. Any coverages outside of individual, like employee spouse or kids or a full family, have the $5,000 deductible. There's co-insurance after that, which means if you have a surgery, you're going to pay the first $2,500, and then you're going to pay 20% after that. And once you reach a maximum out-of-pocket of $5,800, you're done. Everything is covered at 100%. It's good to know that for prescriptions, you have the deductible and then you have copays. So if you do reach your deductible in a calendar year, know that your prescriptions are not at the 20% level, they're at copays. So that sometimes can be a good thing or a bad thing. It just depends on what prescriptions you take. So let's talk about the HSA contribution limits. The IRS determines how much you can fund. Individuals can put away $33.50 per year in 2015, and families can contribute up to $66.50. If you're over 55, you get an additional $1,000 per year in catch-up contribution. And if you'd like to look up more information about that, go to irs.gov and search for Publication 969. We can help you with any other questions you have about why an HSA might make sense for you. HSAs make sense, from our opinion, when you have known healthcare costs every year. And if you can quantify that outside of course, those things that are unpredicted or not historical, it might make sense to be on the HSA. So a lot of times people ask us, how do I use the money in my HSA account if it's not for healthcare-related services? So remember, you can always pull out your money to pay for doctor's visits or dental visits, that sort of thing. What you can't do is pull out the money and use it for non-health related items without paying a penalty. So first off, you're going to pay the income tax on the amount, plus you're going to pay a 20% tax penalty. So keep that in mind when you're setting up one of these accounts that, if you need to pull out the money for other reasons, you're going to lose usually a good 40% of it right off the top. The penalty does not apply for over 65, those or become disabled or enroll in Medicare. So if you're in an age bracket where you're concerned about your health care costs in retirement, you may want to set up an HSA to begin putting money away so that when you're in Medicare ages, you have a nice nest egg to withdraw from. The money in the account is never touched by anybody else. You put the money away. You use it for health-related care and costs, that sort of thing. And then if you don't use it, it rolls over, and you always have the account, unless, of course, you spend it down until there's nothing left. We're going to move on to the Florida Blue PPO 5782. This is a normal PPO plan with copays for most services. Of course, no charge for preventive care. Copays to see the doctor are $35 and $65, and there's a $70 copay for urgent care. Emergency room is at a $300 copay, and then you have a $2,000 deductible with 30% coinsurance after that. A maximum out-of-pocket individual is $6,350. Family is $12,700. With copays applying for your family doctor and specialist, urgent care and emergency room, as well as prescriptions, $10, $30, or $50 for generic, preferred, or non-preferred, this is a plan that most folks would do very well. Diagnostic labs are no charge at Quest, and major diagnostics like MRIs or CAT scans are also at a copay level. Okay? So Blue Options 5770 is our richest plan with a lower deductible. Copays to see the doctor of $25 and $45, urgent care at $50, and emergency room at $200. If you go in the hospital, you have this $1,000 deductible, 20% coinsurance after that to $3,500. And then prescriptions are the same as the 5782 at $10, $30, and $50. Major diagnostics are a $200 copay. Again, folks, I highlight the plans and just some of the key points. Please refer to your benefit guide for a more detailed explanation, or reach out to us here at Highland. We'll be happy to explain and see which benefit plan is right for you. Of course, and you can't talk about the health insurance plans without hitting upon the most important piece, and that's the cost. You'll note that the 5302 plan is a low $20 per week. The HSA plan is $50 per week, and the two PPOs are right around $100 and $120. It does cost you additional to put your family on there. So again, like we referred to earlier on, you may want to check the healthcare.gov for covering your covering dependents. You can also reach out to us here at Highland, and we'll be happy to walk you through some individual options. Again, just to make sure you're not overspending, Employee Plus Children is a great example of this. If I pick the Blue Options 5782, it costs me $114 to add on my kids. If I only have one child, then I'm paying over $400 a month for child coverage. Most children coverage under the age of 18 on the exchange are less than $150. So reach out to us, and we'll be happy to help you with that. Some of the additional tools that are available to you at floridablue.com include the Blue 365 deals for health and wellness deals exclusive to Blue Cross members. Things like non-traditional medicine, acupuncture, that sort of thing. You can get deals there. To search for providers, you go to floridablue.com and click Find a Provider link. The network to search is Blue Options, or go down to the bottom and click the button that says Doctors and Hospitals Nationally. And what that'll do is that'll kick you over to the Blue Card program, where doctors and hospitals that accept Blue Cross PPO, wherever you are at in the country, can be located. One of the questions that we get a lot is, hey, how do I find a doctor if I'm having something done or need to get something checked out that's new to me? And we really like healthgrades.com. It's a free website. You can search by doctor name, specialty, or condition, and allows you to see what other reviewers have to say about that doctor and their staff. Make sure you check on whether or not they take Blue Cross PPO, specifically Florida Blue, but it's a great way to get a higher comfort level when you're looking up for a new situation outside of, say, a family doctor. But you can look up family doctors here as well. Great website that kind of allows you to look up doctors and understand what the reviewers are saying about them. So we're going to move on to dental. Dental program is going to be with Guardian. There are two plans. There's a base plan, and then there's a buy-up plan. The base plan is really a network plan, so you want to stay within the Guardian Life network. Cleanings are at no charge, covered in full. Basic services like periodontics, fillings, and endodontics are covered at 80%. You pay 20%. And then major services are paid 50-50. You get $1,000 to use every year, but you really want to stay in the network with this plan because out of the network you're going to pay 20% for your cleanings, you're going to pay 30% for your basic services, and you're going to pay 60% for your major services. The buy-up plan has richer in-network benefits and richer out-of-network benefits as well. So if your doctor does not take Guardian Life, we recommend you spend the extra couple bucks and take the buy-up plan. You'll have less balanced billing when it comes to out-of-network cost. A key point is that the deductible is out-of-network is much higher than it is in the network on either of the plans. So if you can stay in the network in your area, then you can probably take the base plan and you'll be fine. If you want a better plan with out-of-network benefits, a lot of times today we see pediatric dentists being something that a lot of people like to take their children to. We have not seen good network penetration by anybody's network with this type of situation, so that might be a reason to take the better plan. Payroll deductions, again, these are in your benefit guide, but just a brief glance at the base plan costs you $5, the buy-up plan costs you $7. For that slight difference of about $2, you might want to take the better plan and have better coverage. Next, we're going to talk about the vision program with Guardian as well. $10 a copay for your eye exam gets you your fitting exam, so you know what your prescription is, and then you pay $25 for your hardware. You get an allowance for the frames, and you can get new frames every 12 months, which is great. If you spend over that allowance, then you pay 20%. You get a 20% discount off any amounts above that. You can choose contacts instead of glasses, so if you'd rather get contacts, you can do that. Make sure you go to guardianlife.com to search for providers. We use the Davis Vision Network, which seems to have the most large chain providers and provides great benefit for employees that are all over the country. The plan only costs about $1.60 per week to get, so if you need corrective lenses, then you might want to check out the vision program here. Again, check your benefit guide for additional information. The life insurance is through Guardian. MedSource travelers will provide $15,000 in basic life insurance to all full-time eligible employees. The benefit paid is double if there's an accidental death. We'll talk about voluntary life in a minute, but it is available so you can get an increased amount. And make sure you name a beneficiary. A beneficiary is who would receive the benefit if you passed. It's very important that that gets updated if there's a change in your life. So if you get married or divorced or your kids are grown and you want to leave it to your kids and not your wife, that's all fine. Just make sure you update your beneficiary every year if that's necessary. Voluntary life, so you can elect amounts from $10,000 on up to $200,000. With no medical questions, you can get $100,000 at initial enrollment. You can get above that amount with evidence of insurability, which means they'll ask you medical questions and may decline or approve you depending on how your insurability is. You can elect coverage in increments of $5,000 for your spouse. They just can't get more than 50% of what you elected, and there is a guarantee issue of $25,000 at initial enrollment. The child life insurance is available. You must elect an amount, and then your children can get up to $10,000. There's one premium amount regardless of the number of children. Check your benefit guide for cost, but it's a great way to have something in case something happens to kids. It's usually $1 or $2 a month, so feel free to have to elect that if you elect coverage. Disability coverage is through Guardian as well. Some points about disability that you should know is that disability causes nearly 50% of all mortgage foreclosures. Only 2% are caused by death, and unexpected illnesses and injuries cause 350,000 personal bankruptcies each year. Most working Americans do not have enough savings to meet short-term emergencies. That's why you have short-term disability. And if you're a 35-year-old white-collar male who's out for longer than 90 days, the average after that is that you're going to be out for at least 6 years. So make sure that you have a plan. And 2 out of 3 short-term disability claims are not covered by workers' compensation. Most of the time they're caused by illness and then some sort of accident. So there's 2 programs. The short-term disability kicks in after 2 weeks. It starts on the 15th day of accident or illness. It is doctor-driven. Your doctor needs to say, yes, this person cannot work, You can elect a benefit that is 60% of what you earn per week to a maximum benefit per week of $1,500. So for example, if you make $1,000 per week, then you can elect a $600 benefit. The benefit is received tax-free. So rather than earning $1,000 per week and then paying taxes, you're going to get $600 with no taxes taken out of that. Just so you know, a $300 weekly benefit is only $3.12 per paycheck. So make sure you check that out. That's a low cost to pay to ensure your paycheck. Once you go out on claim, benefits are paid for 11 weeks, so a grand total of 90 days is covered by this program. After that, you're going to move right over into long-term disability. This is a separate benefit from short-term, so if you want to elect just long-term because you have enough savings or plans for what would happen in a short-term emergency, that's fine. Long-term disability kicks in after 90 days. And then there's a 60% monthly benefit with a maximum benefit per month of $6,000. So it covers up those folks making up to $10,000 per month or $120,000 per year. Benefits can be paid to age 65 or Social Security normal retirement age. So for most folks, that's going to be 66 or 67 nowadays. A 39-year-old $3,000 monthly benefit is only $6 per paycheck. So again, when you're looking at what benefits make sense for you, make sure you consider both short and long-term disability, or at least long-term disability. Roughly $25 a month in this scenario is a great cost to pay to insure this out. If something happens to you, the benefit can be paid out to age 65 or Social Security normal retirement age. So a great benefit, one that everyone should consider strongly. So some notes about life and disability. This is the open enrollment for these coverages, and there is no annual open enrollment. What that means is that if you are a late entrant, if you decline now but want it later, Guardian may ask you to produce evidence of insurability, which includes medical questions, and you can be declined. Earnings will be verified at the time of claim, so if your income has changed, don't concern yourself with that because they will adjust your premium if you go out on claim, and every year your premiums are adjusted for your salary. So make sure you understand that. Again, no open enrollment on disability and voluntary life. If you decline now, you can't get it later on without completing evidence of insurability, and you can be declined. Okay, wrapping up here, how to enroll. You're going to go to benefitsconnect.net/MedSource, and everyone must go online to enroll or waive the coverage. The no later than February 9th applies for open enrollment. However, if you are a new employee, you'll have your waiting period, and then you'll be able to go through and enroll. Your office will give you instructions on that. Once you go into the benefits website, it'll ask you for your ID and gives you instructions on what your ID is and your password, and then you get in and then you have to change that. If you have questions, reach out to Highland toll-free and just identify yourself that you're a MedSource employee if Kate or Joe is not available to help you directly. Once you complete your benefit selections, make sure you finalize and confirm your selections. A lot of times people will get in there and get called away or have to do something else and they forget to go back into it. It doesn't take long. Usually your information will have been loaded in there already. If so, it's going to take you less than 5 minutes to make your selections and finalize. So folks, that concludes this presentation on the 2015 MedSource Travelers Benefits. Of course, benefits and plans can change and costs may change as we go through this open enrollment. If that does, you will be notified and you will be given the opportunity to make any changes. Thank you for your time and attention. We're going to go ahead and wrap up, and please reach out to Highland if you have any additional questions. Thank you.